Here we go. Welcome, everybody, to another going to be fantastic and potentially our best episode of Truth or Trend as we are diving into a topic that all three of us believe can be repeated a million more times before people accept the truth about a trend that has been going on for far too long. And there's a lot of people going to have an emotional response to this, and we love you and we want you to know the truth. So we have brought in one of the world's experts on this topic. This is Dr. Annette Schippel of Endocrine Wellness. This is a profoundly large brain that we have sharing space with us today that has fought for, oh my gosh, decades by now. I'm going to get
I
you on
know.
before we say that.
I know.
On
I
this
just,
topic,
I'm that old.
and when we wanted to bring up bioidentical hormones and menopause, we thought we have to have this conversation, and we got to talk about adrenals because we've talked about thyroid, and who better to guide us through the world of adrenals than Dr. Annette Schippel. Welcome to the show. Thank you for being here.
Thank you, Dustin.
Yeah.
Appreciate it. God, do I just get to dive in?
Yeah,
Is
you
that
were
what I
going to
get
tell
to
us the
do?
story. And then we said, no, we need to record the story. So let's hear the story you're going to tell.
Oh, okay. So I was just teaching this past weekend for a group of health practitioners, and we're coming kind of to the tail end. So this weekend, my talk was all about adrenals. And part of my huge emphasis and passion for it is that it touches everything. It has an influence on everything. It influences your thyroid, your blood sugar, your metabolism, your digestion, your immune system, your mood, your cognitive, your ability to put out inflammation. There is nothing.
Your
So I
your
always kind of
marriage.
your marriage, right? So if the adrenals aren't happy, then your body's not happy. But more importantly, as when we're talking about this lead in, Dustin, is that the adrenals are the backup system for menopause, or we could say the ovaries of menopause. Like they take over. And the whole thing is that, yeah, the ovaries are going to quiet down. And, we support the adrenals. We do this kind of support, and we really can be good to go. So I'm doing my talk, right? Next day is like I'm talking about like my top 5 sort of geared towards adrenal. So if they could only choose a few things, right? Like this is what I would pick and why. And so then I opened it up for Q&A, and I, got about 10 minutes. And the last question, I was like, oh man, I got like 2 minutes. And she says, the practitioner is like, so I would like to know your thoughts on bioidentical hormones. And I could tell by the way she framed it that she's really hoping I'm not a fan.
Oh,
And I was like, oh, I was like this. I was just getting like, I could feel myself getting worked up. And I said, all right. I said, are you guys ready for the soapbox? Because I go, this is a hill I'm willing to die on. So I go into the rant, and then I pause and I go, it's blame her. She's the one that asked if you guys don't want this. And I say what you said, Dustin, is like, I know this is not popular, especially now. You've got now the movie stars
uh-huh.
that are influential, have their podcasts. You've got other doctors, going on videos talking about this rave of like all women need bioidenticals. They just need it, and almost as if we're cruel if we don't give it to them. And one of my things that I said, because I got really ramped up, so it was kind of funny, because then Dave Hogshead comes in and he's like, whoa, I think I need to leave the room. But my big thing is that we're not broken. Menopause is not a pathology. It's not a state of disease. We are not broken. And yet we'll sit and we will talk about the harmful effects of birth control and HRT. We'll talk about endocrine disruptors. We'll mouth on and on and on. Is there a greater endocrine disruptor than bioidentical hormones? I would really like to know, because you're talking about a system that everything except for cortisol, less than 1% is in a free state or not bound to a protein, right? That's how tightly controlled it is. I say cortisol is the exception because it's like 4 to 6%, because we would die without it. I mean, that's like a pretty important hormone as far as our hypothalamus is concerned. So I'm going, all right, less than 1%. And we have the audacity and the arrogance that we think we can just add a bunch in and it's not going to be disruptive. And the other thing, I was thinking about this too before we got on today, So what most people are given is they're given DHEA, they're giving progesterone, they're given testosterone, and then also estradiol. If you understand that pathway, progesterone can ultimately end up as estrogen. DHEA will ultimately end up as estrogen. Everything is going to go downstream. Progesterone could go to cortisol, but you don't know because you're not in control. You have no idea. And then the other trend, which you guys might have covered, is that these women get put on these cocktails, and just for good measure, let's throw in some Armour thyroid. Let's just shut the thyroid down while we're at it, and we'll do this whole plethora. And it's the most frustrating and insane thing, especially when I work with women who are coming in estrogen and progesterone positive breast cancer. When we know that estrogen can trigger autoimmune, it can be a culprit when we're looking at cancer, inflammation, osteoarthritis, all these other things. And this is the even bigger insanity. Promised you a soapbox, right? The bigger insanity is when she's a cycling female, we've decided all her problems are estrogen. Every problem she has is estrogen dominance. It has nothing to do with her adrenals, nothing to do with her thyroid. It is, by the way, estrogen will increase thyroid problems because it increases thyroid binding globulin, just to throw that in.
Yeah, and blocks T4 conversion.
Yeah. And yet when she gets into menopause, we decide they all need it.
Right.
But here's the scary part, guys. I'm seeing women in their 40s or late 30s being put on testosterone, being put on estrogen, and sometimes progesterone thrown in for good measure. You want to see someone emotionally completely come undone? Do that to a cycling female. And it's just insane. And I remember I've been doing this for a couple decades, as Dustin pointed out, which is a little bit hard to believe. And I would say that I always maintained that idea that adrenals are the backup system. We don't need hormones when we go through menopause. Well, guess what, guys? I went through menopause. I went through menopause 5 years ago. Did not have to use bioidenticals once. Is it a little uncomfortable? Well, yeah, but life's a little uncomfortable. I mean, what is the problem that we're unwilling to experience a little bit of discomfort? And then I'm like, okay, if we use it short term, you're just delaying the inevitable anyways, if you're using bioidentical short term. And then if you have to use such a low dose to make yourself feel good, right, as a practitioner, then why did you need to use it in the first place? If you would understand how to use whole food nutrition, if you would understand how to use herbs, you would not need to do that. And I can honestly say I've come through it. My libido's in check. I don't have any of the issues that people complain about. Did I go through a transition? Yeah. And I'm glad I did, because now I can appreciate. It's kind of interesting. Sleep is the first thing to get disrupted, right? Your thermostat's broken. Oh, crazy was digestion, because there's a huge shift in those hormones. I would experience acid reflux, kind of like that feeling of it that I hadn't had since my first pregnancy. And I had probably the most god-awful diet, 37 years ago. So I was like, okay, this is new. Constipation that I hadn't had. Was like, okay. But all this was kind of a learning thing. A little bit of headaches, a little bit, initially, I would say a little bit of vaginal dryness but I was like, all right, this is okay. This is what we got to figure out. What was fascinating was, a big thing was getting to sleep through the night. So that's kind of disrupted. And then I'm like, okay, I'm getting a little bit better with this, because, you get these hot flashes and just this. I never got a lot of sweating. I just get this heat surge. The funnier part was it started happening at night first. I think that has to do with liver and other things happening, right? And I remember thinking it would come up my mid back and going, oh, am I getting a fever? Am I getting sick? Is that like 2 or 3 nights? I'm like, oh, no, that's like a heat surge. I'm like, no, this is hormonal. So I kind of chuckled at myself, because really didn't quite know what to expect. But what was fascinating is that what I recognized as I, my hormones were getting better and better. But what I still felt was that when I would get either very upset or very excited, like this conversation 5 years ago, oh my God, I would have had such a heat surge, because I also recognize good stress, even being excited about something, or being upset about something would trigger it.
Mm.
And that kind of comes back into this, that where the adrenals play this huge role, right? Here's another tidbit that I wanted to kind of talk about is that I think one of the biggest challenges when we think about libido, we think about vaginal dryness and things like that, because I test women all the time. I feel like I do very good clinical testing.
What test
And
do you use?
I still use Diagnostics. That is my favorite. It's salivary testing. It's very easy to read. They also have a bone health panel, which is great for the female that's, because they're told, right, that they've got to go on estrogen for their cardiovascular health and for their bone health. I'm like, there's a whole family of hormones there. But what I thought was really interesting is that a lot of times when women would have these complaints, they did not have low estradiol levels. They really didn't. Not for menopause. They were quite adequate. So the thing that I kind of came full circle is it's all about the microcirculation.
Mm.
So if you think about it, this is kind of same for men. If men suffer from erectile dysfunction, honestly, it's a circulation problem, right? You got to have good blood flow. Well, that's not different from women. So if she's got inflammation, her blood sugar's off, different things like that, and if she stays stressed. So what does cortisol do? Causes vasoconstriction.
Mm.
You got vasoconstriction, you're not getting good blood flow to the genitals. So you're going to be more dry. You're going to have more likely to have some vaginal atrophy and also just desire, just, I mean, I really came full circle with going, okay, this is just because we don't show it the way men do, obviously, it's really not different. So when I think about supporting, our postmenopausal woman, yes, black cohosh, my favorite. It's a good estrogen modulator. It will not make estrogen too high. Excellent for vaginal dryness, vaginal atrophy. But a lot of the focus is on the microcirculation and of course the adrenals.
Mm.
And and then with that is keeping the liver healthy, the gut healthy, and so on and so forth. But the answer is not these bioidenticals. And I told people as I was ranting and raving, um, I'm not going to be part of a problem. Like I'm not going to create a problem that I am currently fixing all the time. I don't want to clean up more autoimmune. I don't want to, I would die if I thought I contributed to someone's cancer.
Mm. Mm.
I couldn't handle it. But
Right.
I do think there is an irony of we're all like, don't do this and don't do that. These are estrogen disruptors or these are hormone disruptors. We go on and on and on about it. And suddenly she gets into perimenopause, menopause. Here you go. Here's your smorgasbord of bioidenticals.
So I think some of the great things that I want to just clarify, because we do
Yeah.
have listeners and we want to make sure they're included in the conversation. The
No, no,
adrenal
no.
glands, first of all, are these tiny little glands that sit on top of your kidneys that
Yeah.
help with hormone production. And what we're talking about is this, there's a deviation from what is healthy for our body that has been normalized by just saying, just put more hormones in. And I think one of the best things you just said is like, they're not even testing to see the levels of the hormones. They're just assuming and dumping more in.
Yeah.
You mentioned, a little bit, I'm just going to share this visual that you can maybe riff on a little bit to kind of help people understand that eventually they're going to end up over here in the right in the estrogen categories, right? If you're dumping in pregnenolone or progesterone or DHEA or testosterone, right, we're going to find our way down here eventually, most of the time.
And that chart also shows a lot of why, those hormones become deficient because we're in that chronic stress fight or flight mode. So the body's shunting over to cortisol and aldosterone, right? So the adrenal shutdown, realistically, menopause should be like, oh, the gal saying, oh, wait a minute, it's been a year since I had a cycle. That really should be menopause, not all this chaos of, 10 years of, sweating and changing their, night clothes every night and, all that. I mean, that's blood sugar issues. It's the body not handling stress appropriately. So ultimately, rather than giving these hormones that are going to open the door for cancer, like you so appropriately said, we don't want to be a part of that mechanism, right? So we take, the allopathic, just to put a name on it, the hormone HRT mentality is give the hormones, which, as you talked about, opens the door for cancer. It shuts down the thyroid, so that's, exaggerates the whole weight gain that goes along with it, as well as all the mental emotional symptoms. So if we can keep the adrenals functioning properly, right, then the body's not stealing, as that chart you just showed, Dustin, showed, where we steal from those hormones to get through the stress cycle, right? We're wired to not necessarily want to make babies when we're running for our lives, right? So that's that, and then we chill out, and then the hormones of desire and romance and creativity and healthy digestion all function properly. So keeping those pathways functioning properly is a million times better and more appropriate for us as thriving human beings than trying to, hormonally manipulate what's going on.
Well, and I think what we have to, and this may be a little bit clinical, but I still think it's worth saying because I explain everything. I just try to make it a little more digestible. But stress response is 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 the most important thing to the hypothalamus, right? So it doesn't care. It doesn't care if it's real, perceived, if it's blood sugar, if it's chronic inflammation, different things like that. It becomes the ultimate. And if you think about it, cortisol is the most strongest on one side of the pathway, our most potent anti-inflammatory hormone. Estradiol is actually stronger than testosterone. It's our most potent anabolic hormone. So when you think about it, because what's fascinating in high and prolonged stress, the aromatase enzyme pathway will have an increased expression, right? So the testosterone is lost down to estradiol. But here you got these two that it's like hypothalamus is at the end of the day, okay, well, we don't want you in just catabolism, which cortisol by itself would do. So you get in this downstream, kind of think this is a little bit of what goes on with what you're talking about too, Dr. Scott, is that now we got estradiol, strongest in very small amounts, right? But we need it. And now we got that cortisol. And it's this, and again, it doesn't necessarily feel very good because everything else that softens and balances in the in-between kind of gets lost in this strong, chronic stress response. And the problem is that by the time women hit menopause, again, if they're not supported adequately, perimenopause, which should be 2 to 3 years of just feeling some fluctuations, changes, turns into 8 to 10 years. And yeah, by the time they get to menopause, like you said, they're still suffering 10, 15 years later. I mean, I get why women think that this is the best rescue ever. It's just we're missing the conversation that we want to have with them. And here's the insane part. When I see the women that come to me and they've been put on bioidenticals by someone else, they're usually given progesterone that in a level that you would give someone to maintain a pregnancy. Tell me how in the hell that is correct. And I'm just like, it just blows my mind. And guess what that does? It sedates the GI tract. So if they're already struggling with constipation, which is can be a pretty common thing.
Can you repeat that? What exactly is sedating the GI tract in that so that they're aware?
So when you progesterone, so think of it as like over the top parasympathetic, right? The rest and digest. Whereas estrogen is sort of excitatory, progesterone's like, all right, you need to calm down. But too much progesterone, then it becomes depressive, both to your body as well can be to the brain. It also increases ligament laxity. So then those of us that do structural care, suddenly, they're more prone to injury. They're not holding an adjustment. It's
sore after being adjusted.
Yeah, because when you're pregnant, there's a whole purpose, but also estrogen levels rise with pregnancy as well, just not as high. But the whole thing with menopause, the reason we don't have that much progesterone, nor are we supposed to, is we're not ovulating. You don't ovulate, no corpus luteum, no big rise of progesterone. So it really does come back to those adrenals.
This might be a woman with too much progesterone, maybe a woman who gets constipated at a certain time in her cycle, right? So in her cycle, would you say perhaps the progesterone should normally be at its highest? And if she's experiencing constipation at that time, what would we do about that? And Dr. V, what kind of a headache would they be experiencing if that was?
So in general, as she was just saying, for the lay population that's listening here, in general, progesterone is going to be constipating. Estrogen is going to be set up diarrhea, or softer stools in general.
So they balance each
Estrogen,
other,
right?
ideally.
Ideally, right?
Yeah.
Estrogen is acidifying, as you alluded to, which opens the door for yeast, which opens ileocecal valve of Houston, so accelerates the elimination process, right? Whereas progesterone, there's progesterone receptors in the gallbladder, so when the gallbladder gets affected and we don't digest fats properly, and that slows digestion, right? Think pregnancy. People always say, "Oh, the baby's big and pushing on my intestines. Now I'm constipated." It's the progesterone I actually first learned this from the pregnancy calendar back almost 30 years ago when we were dealing with our first pregnancy. Then I learned that there's progesterone receptors, as I mentioned, in the gallbladder. So again, that sets up heartburn, right? And everybody says, "Oh, the baby's got hair, I have heartburn now." So that progesterone inhibits the gallbladder, opens the door for the hiatal hernia, where the stomach slips up to the esophageal opening there. That's a gallbladder concern as well. So progesterone can cause that. So again, if gals given synthetic hormones like that, these are some of the other mechanisms that come into play. Again, think of the gal that has cravings during their cycle, right? Estrogen and as Dustin asked, the headache that's going to go along with poor estrogen metabolism is a bitemporal headache. So we're going to have, kind of like I keep using my headphones as an example of a bitemporal headache. That's a poor estrogen metabolism headache. So then if it's affecting the thyroid, that's going to be a tension headache. In other words, a headache on both sides of the back of the head. And so that's a thyroid concern if hormones are affecting that. So for the lay public, again, progesterone is constipating, estrogen is what's the
Stimulating. It's stimulating. I mean, you could say it's
from a
stimulating.
digestive process is what I was trying to refer to though. So and that all affects gut biome, and then so if the gut biome's out of whack, then we have the whole headache, or what I call the headband type of a headache. Typically, if somebody's trying to describe a headache, that's the hardest one because it is the whole head. But those are some of the headache manifestations that can go along with the hormone things that Dr. Schippel's talking about here. So,
Dr. Schippel, can I ask you this? What are some things that are going to create a progesterone dominant situation, right? If we're having too much progesterone or.
So I want to really tie in on that.
Yeah.
You won't.
Okay.
You won't. So progesterone dominance, in my clinical experience, I'm going to say this of 20 plus years, never ever happens unless someone's on a bioidentical. So when someone's on a synthetic, it blocks progesterone receptors, so they actually get really, really low levels. So that's the issue with birth control. It will suppress progesterone and estrogen because it's synthetic, but it leaves them still just enough estrogen dominant that we have a lot of those side effects that we see with birth control. The problem, and I think this is where kind of what Dr. Scott's talking about, it's about the balance, right? It's about having, estrogen and progesterone and balance each other. If you looked at a female cycle, even in the luteal phase, progesterone is supposed to have this big rise, this big bell curve, and then it drops off, right before she has her period, her menstrual cycle. You will also notice that estradiol will have a little bit of a spike as well. Like it goes up when progesterone goes up because they have receptors for each other. So the issue really comes in when they're having digestive issues, like right before their period, like you said, either too loose. It's hormones, if too high, too low, create the same problem. So too little of estrogen could be one problem, too much, and it could actually be constipating because there's not enough to balance it out. So to me, it's all about that. So the bigger issue that happens is that stress causes the breakdown or causes progesterone levels to drop off. So if she's under a lot of stress, and this gets into what you and I, we could all talk about, prolactin, attacking the corpus luteum, dropping progesterone levels, yada, yada, yada. But so a lot of times what happens is you'll see she'll get a peak of progesterone kind of like right after ovulation, but she can't maintain it because she's got stressors that are robbing her of it that have a more specific impact on that particular part. See, estrogen is pretty much most of our estrogen, if not all, is produced in the ovaries. We produce very little progesterone and testosterone from the ovaries. We have some from the adrenals. The progesterone that from a perimenopause cycling state is all from the corpus luteum. So that's why if she doesn't ovulate, she doesn't have a strong ovulation, it's not a very healthy corpus luteum, all of these things, this is what starts to impact her. And then, of course, stress just makes everything 10 times worse. So what you'll typically, now I have seen, because you brought up synthetic progesterone, and that is what we know as progestin. So sometimes you will see in postmenopause, going back to that, they'll be put on estradiol, which is bioidentical, and then they'll be paired with progestin, which is like the worst possible combination, because then that's going to suppress her already low progesterone levels, and now you just gave her a bioidentical. There is so misunderstanding especially in the allopathic world. I actually had a conversation with an oncologist that specialized in female health. She did not realize or even understand the difference between progestin and progesterone.
Wow.
So it's always our job to look at it. Now, when I talk about someone having enough progesterone to maintain a pregnancy, that is bioidentical. They're giving them either like Prempro, I think that's right. Prometrium, sorry, it's Prometrium is the bioidentical progesterone, or they just put them on a cream. And the thing about which you were kind of alluding to, all the different ways it affects the gut. Well, when you get into creams, especially progesterone, because remember, it's a very weak upstream hormone. So the body's designed to hang on to it more. It'll clear out those downstream hormones quite quickly. It is designed because, it could be dangerous, right? So it's really good at clearing out estradiol, testosterone. You could pull that away. She'll clear it pretty quickly. But that progesterone, man, it likes to hang on into all the tissue, to the fat cells. It can take, without good liver support, it could take as long as she's been on it to clear it. So she could be on it for 4 months. You could take 4 months to clear it. And once it stores in the tissue, it can just release indiscriminately. And then it's like you're back into hormone chaos and you don't know what's what.
So what are let's talk solutions just a little bit, right? For the listener out there. What are some of the
They're like, please.
that you need to start to do?
So we do have that. I want to get there with you. But as we transition to the solutions, we haven't talked about insulin yet, right? We've talked about cortisol, it's a big old deal, but insulin in the male converts testosterone to estrogen. So then the guy's going to be crying, watching, crying at chick flicks and have man boobs, in the female, it causes testosterone to convert to, or causes estrogen to convert to testosterone. So for most of what I see for these gals that have hot flashes and challenges and this prolonged perimenopausal season, it's typically too much fruit or too much refined sugar, causes that hormonal chaos. So as we transition, there's a pun on this subject. As we transition to solutions, we need to look at what we can do to stabilize blood sugar to minimize these symptoms, so that then they're not so prone to consider HRT and hormone replacement, right? So we need to have that discussion as we start going into that.
Insulin more interferes with testosterone and estrogen so much as it doesn't really convert estradiol back into testosterone.
It can't. It's not a biphasic pathway. Testosterone can only go down to estradiol. But what I think what you see, so testosterone, and so in PCOS, which is known to cause insulin resistance, what we really
polycystic
have,
ovary syndrome.
yes, we
for the
have
lay public.
Thank you. We have elevated testosterone and elevated estrone, which increases the insulin resistance. So if a guy went on high testosterone, let's say he's getting testosterone injections, whatever, he would become insulin resistant, one, because of the testosterone, and two, because the testosterone would convert to estradiol. It also really would elevate the triglycerides. So I think the difference is, so with men, if there's sort of this pathway interference, you guys can handle testosterone, right? If your levels go up into a higher state, you're not going to notice, but the conversion down to estradiol is going to cause exactly what you're talking about. The more emotional, the man boobs, all the things that are not good. Whereas women, we're the opposite. We can handle a little more estrogen overall, but we're not designed to handle these high levels of testosterone, which is where the more tenacious, signs of insulin resistance, maybe cystic acne, hair growth and hair loss in places we don't want. But the other thing that I think that's really important besides that hormone pathway, this is my superpower. Dr. Scott, is to pull things back to what I care about the most. No, just kidding. But is goes back to the adrenals. So in prolonged stress, wherever cortisol goes, blood sugar goes, and cortisol antagonizes the function of insulin. So when you've got the stress response plus the rest of the hormonal imbalance, then it's aggravated by the diet, right? So we do want more fiber, more fats, more protein, and fiber is just going to be a big one because it's going to help, bind to these excess hormones and make sure they don't deconjugate and go back into the bloodstream. But yeah, I just want to kind of clarify that it's still that whole family of hormones that if it's out of sync and dysfunction, that it sort of turns into a vicious cycle, right? Like the stress and then the estrogen, for women and men can be pro-inflammatory, which creates more stress and creates more of the insulin resistance. And lifestyle has to change. You can't, hormones are stronger than a diet, but the diet, if you don't change it, is never going to allow you to correct the hormone imbalance.
Well stated.
Yeah.
Does that get to some of the solutions you were looking for, Dustin?
A little bit, yeah. Well, I want to clarify and repeat those for people, though, because what are the top things you're seeing that are missing from people's diets that are exacerbating this hormonal imbalance? And I think you mentioned fiber. I think fiber is a huge piece for that, right? And what are your suggestions for people to increase their fiber to help bring balance to this?
So I really think like when, my big one is when they can do it, do more legumes. Legumes are like the superfood when it comes to high fiber, high protein, and they don't have a high carbohydrate load. There's lovely things about quinoa and rice, but they're really high carb relative to the protein and fiber. I'd probably pick quinoa over rice, but really I try to get my patients eating more legumes. Avocados are really good. Sorry.
Can you give us some examples of legumes?
Okay, sorry. Yeah, legumes is anything in, like, think in the bean family. So we've got black beans, you've got chickpeas, you've got lentils. It could be sugar snap peas. Really, those are kind of the highest ones that I tend to go towards. Not unless you did true edamame. Like if you did the whole soybean, fine, but I would not ever.
I just need you to validate my black bean theory. That's all. So thank you.
Oh my God. Okay. You're welcome, Dustin. I didn't even know this was not pre-planned, but no, I think incorporating that. And here's the thing is that some people will say, oh, I can't do it. It really makes me gassy. Well, that's a digestive problem that we got to work on, right? Because, there are certain cultures that they have beans every morning. And I think that, we need to kind of get back to some of what we do in the US as far as just real food. So I do love really talking to him about the legume family. And then I have to say the lectins are destroyed when you cook them. So if you're following some other person out on social media that says lectins are bad, Dr. Gundry, do you know he's come full circle? And now said, oh, well, sort of. But like if you're sensitive to them, don't do it. I get snarky, I get. But the truth is, whenever you cook a legume, and nobody would ever eat a legume uncooked. Have you ever seen beans uncooked? You're not going to do it, or chickpeas or split peas. So once you cook them, you break through those lectins, and that is not the problem. If you're gassy, you're bloated, you've got to fix your digestion. You got to strengthen your digestion. But I think I really do. I feel like I think they say the average adult gets maybe 9 to 10 grams of fiber per day.
Yep.
RDA is like, we need 30. So if the RDA says 30, we probably need closer to 40.
My target's always 30 to 40 for people.
Yeah.
Beans gets you almost all the way there. One bowl.
Oh, I know. And and I think that the protein, especially for our postmenopausal women, if we're talking about that, it's the building block to make all your hormones. And I think that's where we struggle the most, is that we're not getting enough protein. We don't have those building blocks. And it's not to make carbs bad, but it's to get rid of the refined carbohydrates, really just get back to real food.
Right.
Your vegetables are going to have some fiber in it, but the problem is most of us cannot spend all day just eating greens to try to get that amount of fiber in. And that's why I say like the legumes, but there's other phytonutrients in our, eat the rainbow, right? Eat the rainbow and the leaves, the root vegetables, eat lots of mushrooms. They're going to be really good for us, especially on a vitality standpoint. Yeah. So sometimes just starting with the diet is just so simple and it can just be a game changer.
We all have 10 more minutes to jump into some herbs as well. I mean, I don't know if
Okay.
we're doing on time here. Dr. V, you good to hang in?
Okay.
Yeah. You might have to do a part two, right? Because
Just 10 minutes.
you've
Just
mentioned the
10.
hypothalamus so much. I want to talk about that too, right? So people understand why you're talking about that being the chief executive in charge of this whole system.
Thermostat.
What's
Yeah.
that?
It's a thermostat.
Right.
There's your hot flashes, right?
Right.
Yeah. Always,
Exactly.
I think my thermostat set a little higher than it used to be, but I'm good. No, I think so I use standard process, right? So I love things like hypothalamus PMG. I use a lot of Neuroplex. That's kind of my I think I found Neuroplex really to be my favorite when I went through menopause because it has the brain support, hypothalamus, anterior pituitary, but then it's like a multivitamin
Don't get me wrong,
for
I love
your
that product.
brain.
Love it.
I
Zinc,
I just
vitamin D3, B6. So talk
and
about dosing for yourself. Let's talk about that a little bit when it comes to neuroplex.
well, the thing that I love about Neuroplex is that I feel like I don't need a lot of it. I 2 a day. It's kind of the recommended dose anyways. Bottle lasts me 45 days and I just love it. The thing that I tie into this is when you use herbs that are considered adaptogens, these are the things that also support HP axis, so hypothalamus pituitary communication. And I would say that, some of that shifted a little bit. I also make sure so standard process wise, my favorites are Easy Mag because that has a lot of potassium, so that really supports the parasympathetic. It's rich in magnesium and other phytonutrients. Kind of right now, I'm into using Drenamin just because I like things that multitask. So that gives me my B's and C's, right? Kind of like my B's and C's there.
So
And
Drenamin has the vasorelaxing portion of the B vitamins, so
yep,
it's going to help ladies help keep your blood pressure down.
yep,
The B2 in there is also going to help with fat metabolism, progesterone
I love
metabolism.
this.
Conversely, Vasculin, right, was originally designed for varicose veins. That has the vasotonifiers. That's in theory are potentially going to elevate blood pressure. So that's why we use Adrenal, and that's pretty typical in this type of season that we're talking about,
Yeah.
perimenopausal and so on.
And it's rich, it has mushrooms in it for vitamin C, but we also get lots of other benefits. But that was a great rundown on Drenamin. And then, kind of depending on, I do some blood chemistry. So, right now I'm doing calcium lactate, which by the way can also help women with menopausal symptoms. I always do a good fish oil, right? And sometimes I'll depending on my levels, I might do vitamin D and complex F. I do find like vitamin D does get sometimes the vitamin D drops because of stress, because it's part of that steroid hormone family. So I think it's really important when you're looking at, does someone really need it? Go to look at calcium. Because if calcium's low, then yeah, you got to do vitamin D and calcium. But if their calcium's really good, their vitamin D, think about what the primary issue is, because that might take you back to stress. Make sure you do the good fats and so forth. Now, herbs, let's talk a little bit about this, kind of quickly, because we've got like 5 minutes or so. So I do think chase tree can be a benefit both perimenopause and menopause. And part of that is because on one hand, when she's still in the throes of perimenopause, it's a beautiful support for the corpus luteum. It's a dopamine agonist that just makes her feel calm and happy, supports melatonin, which can help her with sleep. And we know that it's really nice for normalizing prolactin and LH. And it's that prolactin that goes up under that stress response. So I feel like if she's struggling with sleep, and maybe some anxiety and a little bit of mood issues, and certainly if she's still in, her cycling years, but it does have a benefit, I would say, even into menopause. Probably, as Dustin knows, I love to blend liquid herbs. So I could give like some formulas, but I would say, early on, I love Romania and Schizandra. So that gives me some really good adrenal liver support. It's also excellent for the sweats and the heat. So those night sweats, hot flashes, it is phenomenal. And I love that Shasandra's an adaptogen. So it helps us adapt to stress, helps with mood, helps with focus and attention. But a big one is also the liver, which is going to have to help us, our hormones get more balanced, right? And Romani is this beautiful herb for the adrenals that's both a tonic and tropho-restorative. So meaning really healing those glands.
And help prevent autoimmune conditions.
Yes, absolutely. I sometimes I'll have a couple tonics. This is where, but I think in menopause, ashwagandha should
Yeah.
be a big one because not only does it normalize cortisol, it helps bring up DHEA. It's a beautiful herb for the thyroid, right? Improving T4, T3 production, conversion of T4 to T3. It's also for anxiety, it's for insomnia. It's considered a neuroendocrine immune support. So it kind of lives in some of the tonics that I do, or someone could do it as a standalone, like the ashwagandha forte. I mentioned black cohosh, so when I do a blend,
Are you
yes,
breaking down your goddess tonic for us right now, by the way?
pretty
All
much,
these in your goddess tonic. Okay.
pretty much,
A lot of my clients on this goddess tonic. And
yeah.
I just want to say really quickly that I had a great meeting with a master herbalist last week, and he was talking about how Chinese medicine, they start with at least 4 herbs. You're never going to see a blend less than 4 herbs in their medicine. Up to 20 herbs is what they'll put into that. Where Ayurvedics, he said, will do sometimes 10 to 30 different things combined together, which can get very complicated, right? But so it's interesting that you're already at 4, and I love that. So let's
So some of it depends on what I need to be therapeutic. So I would say like from an herbalist perspective, and I think just because I've studied Kerry Bone, taken his courses so much, I think they tend to be on the smaller side of usually 3 to 5, right? And I think that's just because if I have to go, depending on what I need to be therapeutic, if I have to go beyond that, and so my goal is a teaspoon twice a day.
okay.
So the difference could be is when you're using a lot more in there, then they might have to take 10 mils or 2 teaspoons twice a day. So I kind of try to keep it a little bit smaller, and then I can also see what's working, what's not,
Right,
right?
right,
So
right.
that sometimes that kind of varies, I think, on that note. But like for instance, Korean ginseng is very good as a whole body tonic. It's great for balancing blood sugar. It's great for the heart. It's a cardiotonic. So it has all these beautiful benefits. But if we're using the liquid MediHerb ginseng, it's therapeutic in a very small amount. So in a 200 ml tincture, 20 mils, maybe 30 max, right? So that gives me room, for other things, right? So, and kind of like black cohosh, you don't need a lot usually in like the goddess tonic that we were talking about. Like, so Dr. Scott, I have like probably 5 goddess tonics, and it just kind of depends on what we're addressing, but usually 30, maybe 30 to 40 mils, right? And then it kind of
How
depends on
big of a
again what I'm
combination are
at.
you talking about here? Just to give people context, right? You're saying 30 mils out of, you got a
200.
200 milliliter bottle. You're
Yeah,
30 of that is black cohosh, is what you're saying.
right.
Go ahead. Give us.
Yeah. So here could be here's an example. I could do depending, let's say that thyroid's humming along pretty good. I could do 60 mils of ashwagandha. I could do 30 black cohosh. Then I could do 40 Romania, 40 Shazandra. So that puts me at what? 170.
170, exactly. Good math.
And then I could, let's say I just want to do some extra like microcirculation or maybe just vitality. I could add in say 30 Korean ginseng in this scenario.
Green ginseng, not
Or
ginkgo.
or I could do ginkgo
Okay.
or I could do gotu kola.
Aha. Okay.
So it kind of depends on what I'm doing, and that's where, I could never decide on just one goddess tonic. I had one that was actually it was Superman, right? Do you remember Superman?
Oh, remind me.
So
Superman.
so Superman was 70, it was 70 ashwagandha, it was 30 ginkgo. It was actually 40 chase tree, 40 Shazandra, and 20 Korean ginseng. And the reason I did that was because a common thing that happens with men is losing that testosterone. down to estradiol because of stress, because of prolactin. So especially if you've got a guy where his LH is low, so he's not getting the, hey, you need to make some more testosterone, Chase Tree is beautiful. If I feel like it's more mental, like they're getting worked up, like anxious about in the bedroom, all that stuff, I will sub out the Chase Tree for skull cap. It's really cool. And then the fun part is I actually have husbands and wives that take the same tonic.
So
So
you're
tell
using
us,
Chase Tree instead of Tribulus for the LH on the
yes,
male?
because tribulus is more specific to FSH from a pituitary standpoint, right?
Mm.
So it's a really good, I think, steroidal saponin. So it does kind of help overall vitality. But I'm finding the men in my practice are doing better on ashwagandha because stress is at the root of their sort of loss of vitality. So
Mhm.
I feel like the ashwagandha does more on the stress response,
100%.
DHEA, things like that. So, but it's
Mhm.
but it's kind of like if they respond well to Tribulus or Tongkat Ali, that's
Mhm.
awesome. But I can't blend them, so there you go.
There it is. Yeah.
But you could add that in. But and again, if there's more issues with, say, vaginal dryness, I need more of the microcirculation, gotu kola, ginkgo, Korean ginseng with the black cohosh. Those four are going to be key. And then whatever else I decide to pair it with, right? But it's nice because like ginkgo, 30 mils and a 200 mil, you can get away with 20 Korean ginseng and like 40 gotu kola. So you don't need a lot, but it can be so amazing. And this again is coming from someone who's used it and honestly saw a difference. I'm like, because at first I was like, what's going on here? And then I'm like, all right, this is so cool. I feel so much better. And working with other women in my practice who, having that vaginal dryness but also what I love about it is that I also in that tonic, I also get to give this beautiful endocrine support, right? Thyroid, adrenals, the liver,
Mhm.
I get to give this all in one instead of three or four different products. So that's why I do it. But
Is there another
yeah,
to help support the hypothalamus specifically?
Okay, so really quick, anything that's an adaptogen technically is going to support hypothalamus and pituitary, like even echinacea. A lot of people don't realize that echinacea helps uh, get someone out of that fight or flight response. Now, that's more because of how it supports the endocannabinoid system, but that's for another day, right? So, two really quick ones. This I learned from Lee Carroll. Use hawthorn for someone who's stuck in sympathetic dominance, which makes sense if you think about, as you were talking about, Scott, with the heart and blood pressure. What happens when we're in high stress? Blood pressure goes up, the heart, different things like that. And hawthorn is kind of giving your heart a hug. So I always think of that for someone stuck in sympathetic dominance. Also, really good for men. Men with erectile dysfunction, again, because of that sympathetic stress response, can actually really, really help with that as well, which is kind of cool. Now, Rehmannia, we think of for someone who has a stuck pituitary. So it's kind of like your hypothalamus is saying, hey, what are you doing? And the pituitary is just like, you know what? I'm tired of you yelling at me. I'm just not listening anymore. It's kind of like a couple, right? They've been fighting for a while, and now one just sort of shut down. so, so he would talk about Rehmannia for the stuck pituitary, which I just love because, again, it's this beautiful adrenal, like you said, autoimmune. It helps with joint arthritis, liver, kidney, very gentle detox. So it's just awesome.
Mm. Wow. Okay, listen, I think we're gonna have to bring you back, is what's gonna happen.
Okay. I know you guys might have to have a few without me because obviously I'm sorry if I steamrolled you both on the conversation.
Kind of
It's all
warned that you
good.
would, right? You haven't had you
I
ever
did. I did.
And we did cover some of this on a previous podcast as well. So
We
we
did.
we
No,
have
it's
more.
just but I love the I mean I know I talked a lot, but I just loved what you guys added in and I love that
Mhm.
rant on Dreneman. That was awesome. Because I was just like, yeah. And here he comes in. Dr. Scott was like, well, let's talk about it. I was like, yes, way to go. So
Dustin, are you going to summarize all this?
Uh, Here's the summary. There's so many things you can do. The right person guiding you with herbs and
oh, yes.
there's so much
Yes.
more you can do that's going to affect your whole body and not just looking at these numbers and your hormones and throwing in these hormones that can create more chaos and more mess down the road. So find somebody like Dr. Annette Schippel at Endocrine Wellness or Dr. V in SoCal and have them guide you. Your world is going to be better for longer and everything's going to get better. I'm going to make a Superman tonic immediately. In fact, I'm going to after this for that. Forgot about
Awesome.
that. Yeah.
Yeah.
So looking at herbs to help stabilize the stress response, right? It's going to help smooth out that whole perimenopause because in general, ovaries, are shutting down and adrenals need to pick up the slack. So
Yeah.
look at herbs, the signs of, chronic stress, not waking up vital in the morning. There's a sign that your adrenals aren't going to be there to support, ladies, your transitional years, your perimenopausal, menopausal years. So look at adrenal adaptogens, manage the stress appropriately, get proper sleep, keep your blood sugar stabilized, minimize the sugars and, too much fruit even potentially are going to contribute. Eat your, good sources of fiber to bind up those hormones because the body, those hormones are floating around in the intestines ultimately on their way out. If they don't go out and they get reabsorbed through a leaky gut or something, if we don't have enough fiber, then we have trouble and we have these estrogen dominant symptoms. So keep your vegetables, your legumes, your good sources of fiber in there to bind that stuff up. That will help you ladies smooth through the transition. As my wife was going through this, one of her favorite GI Adsorb was she every day she talks so she'd be playing volleyball with her fellow perimenopausal friends, and every day she'd come home, I need another bottle of GI Adsorb for my my girlfriend over here and for my friend over here. So they were all stoked on GI Adsorb to bind that stuff up and smooth through those years. So again, just applying all the stuff, the great information that Dr. Schippel has shared with us, and the pearls, apply, re-listen to this podcast because there's, every minute is full of, pearls to apply. We're going to be covering this material over and over again in, many different ways. So re-listen, find somebody that can help you smooth through this transition that recognizes the upside consequences of doing HRT so that you can live long and flourish and thrive, ladies and gentlemen.
Yeah.
Mhm.
Well, I'm gonna hit the end of recording here. So thank you. Annette, any last words for everybody out there?
Oh my gosh. Oh yes. Women, we are not broken.
There you go.
We,
That's gonna be the title. Women, we are not broken. You got
there
it.
we go.
All
I love
right.
it. Thank you guys.
Thank you. Thanks for watching.